If you've successfully treated your heel pain, congratulations. But here's what most people don't realize. Getting rid of heel pain is only half the battle. The other half is making sure it doesn't come back. And unfortunately, recurrence is incredibly common when people don't address the underlying factors that cause the problem in the first place. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. In my 25 years of practice, I've seen countless patients who successfully treated their heel pain only to have it return months or even years later. Today, I'm going to show you exactly how to prevent that from happening to you. Here's the hard truth. Most people fix the symptoms, but not the cause. They get their pain under control with treatment, feel better, and then go right back to the same habits and activities that caused the problem originally. It's like fixing a leaky roof, but not addressing the structural issues that caused the leak in the first place. The patients who stay pain-free long-term are the ones who understand that prevention is an ongoing strategy, not a one-time fix. They make permanent changes to their daily habits, their footwear, their activities, and their foot care routine. Before we dive into the specific prevention strategies, I want you to know that I've written a comprehensive guide about heel pain prevention and long-term management. You can get this guide completely free at www.heelpainbook.com. It contains detailed information about everything we'll discuss today, plus specific exercise routines and prevention protocols you can implement immediately. Also, please take a moment to like this video, hit the subscribe button, and share with anyone who's successfully treated heel pain but wants to make sure it never comes back. Let me start by explaining why heel pain recurrence is so common. There are several risk factors that, if not addressed, almost guarantee your heel pain will return. The biggest risk factor is tight calf muscles. Your calf muscles connect to your Achilles tendon, which is attached to your heel bone. When your calves are tight, they create constant tension on the heel with every step you take. This tension can lead to both Achilles tendinitis and plantar fasciitis. Here's what most people don't understand. Calf tightness develops gradually over time due to our modern lifestyle. We sit at desks all day. We wear shoes with heels. We don't move enough, and we don't stretch regularly. All these factors contribute to progressive calf tightness. Even if you successfully treat your heel pain, if you don't address the calf tightness that contributed to it, you're setting yourself up for recurrence. The second major risk factor is poor footwear habits. I see this all the time. Patients who do everything right during treatment, wear supportive shoes, use orthotics, and get better. Then they go back to wearing flip-flops, high heels, or worn-out shoes, and their heel pain returns. Your feet don't magically become stronger or more resilient after treatment. If unsupportive footwear contributed to your original problem, it will contribute to recurrence if you go back to those same shoes. The third risk factor is overtraining or sudden activity changes. This is especially common with runners and athletes who return to their previous activity level too quickly after treatment. Your tissues need time to adapt, to increase stress even after they've healed. I've seen marathon runners who successfully treat their plantar fasciitis, then immediately go back to running 40 miles per week. Within a few months, their heel pain is back, often worse than before. The fourth major risk factor is foot mechanics. If you have flat feet, high arches, or other biomechanical issues that contributed to your original heel pain, those issues don't disappear with treatment. Without ongoing management, they'll continue to put stress on your heel. Now let's talk about the daily habits that prevent heel pain recurrence. These aren't complicated or time-consuming, but they need to be part of your routine. The most important habit is a consistent stretching routine. And I'm not talking about stretching when you remember or when you have time. I'm talking about a dedicated stretching every single day, preferably at the same time each day, so it becomes automatic. Your stretching routine should focus on three main areas: your calves, your plantar fascia, and your Achilles tendon. The key is consistency, not intensity. It's better to do gentle stretches every day than aggressive stretches once a week. For calf stretching, you want to stretch both the gastrocnemius and soleus muscles. These are the two main muscles in your calves, and they need to be stretched differently. The gastrocnemius is stretched with your knee straight, while the soleus is stretched with your knee bent. Hold each stretch for at least 30 seconds and repeat it 2 to 3 times. Do this routine twice a day, once in the morning before you start your day and once in the evening before bed. Plantar fascia stretching is equally important. The best time to do this is first thing in the morning before you get out of bed. Use a towel to pull your toes back towards your shin, or do the classic plantar fascia stretch by pulling your big toe back with your hand. Here's something crucial. Consistency matters more than intensity. You're not trying to achieve maximum flexibility in one session. You're trying to maintain healthy tissue length and prevent the gradual tightness that leads to heel pain recurrence. The second essential habit is strengthening exercises. While stretching maintains flexibility, strengthening builds resilience and helps your feet handle stress better. Focus on strengthening your foot intrinsic muscles. These are the small muscles within your foot that support your arch and help with shock absorption. Simple exercises like toe curls, marble pickups, and towel scrunches can make a big difference. Don't neglect your calf strength either. Strong calves provide better support for your heel and can prevent both Achilles problems and plantar fasciitis. Calf raises are simple but effective, starting with both feet, then progress to single leg calf raises as you get stronger. The key with strengthening is gradual progression. Start with exercises you can do easily, then gradually increase the difficulty or duration. Your goal is to build strength over time, not to exhaust yourself in one session. Now let's talk about your shoe strategy, because this is absolutely critical for long-term prevention. First, you need to understand what to look for in supportive footwear. Good shoes should have adequate arch support, heel cushioning, and a firm heel counter. The sole should be thick enough to provide shock absorption, but not so soft that your foot sinks into it. Running shoes are often your best bet for daily wear because they're designed to handle repetitive impact. Even if you're not a runner, running shoes typically provide better support and cushioning than casual shoes or dress shoes. Here's what you need to avoid: worn out shoes, completely flat shoes like flip-flops or ballet flats, and shoes with inadequate support. Just because a shoe is expensive or fashionable doesn't mean it's good for your feet. Pay attention to the wear pattern on your shoes. If the heel or sole is worn unevenly, it's time for new shoes. Worn out shoes can't provide proper support and can actually contribute to biomechanical problems. Another crucial habit is avoiding barefoot walking on hard surfaces. Your feet weren't designed to walk on concrete, tile, or hardwood floors without any protection. Even if you're just walking around your house, wear supportive slippers or house shoes. This is especially important first thing in the morning when your plantar fascia is tight from being in a shortened position all night. That first step on a hard floor can re-injure healing tissue. Let's talk about long-term support strategies. Even after your heel pain is gone, you may need ongoing support to prevent recurrence. Orthotics play a crucial role in long-term prevention, especially if biomechanical issues contributed to your original problem. Think of orthotics like eyeglasses. They don't cure the underlying issue, but they provide the correction needed for optimal function. If custom orthotics were part of your treatment, you'll likely need to keep wearing them long-term. The good news is that well-made orthotics can last for years with proper care. If you weren't using orthotics during treatment, but you have flat feet, high arches, or other biomechanical issues, you might want to consider them for prevention. It's much easier to prevent heel pain than to treat it once it develops. Activity planning is another important aspect of prevention. This doesn't mean you have to limit your activities forever, but you do need to be smart about how you progress. If you're returning to running, sports, or other high-impact activities, do it gradually. Follow the 10% rule. Don't increase your activity level by more than 10% per week. This gives your tissues time to adapt to your increased stress. Pay attention to your body's signals. Some muscle soreness after increased activity is normal, but heel pain is not. If you start to feel familiar heel pain returning, back off your activity level and focus on stretching and strengthening. Cross-training can be incredibly valuable for prevention. Instead of doing the same activity every day, mix in different types of exercise. This prevents overuse of any one structure while helping to maintain overall fitness while reducing injury risk. Now let's talk about when to check back in with your healthcare provider. Prevention doesn't mean you never need professional guidance again. If you start to feel any heel pain returning, don't wait to see if it goes away on its own. Early intervention is much more effective than waiting until the pain becomes severe again. Schedule a checkup if you notice changes in your foot structure, your gait pattern, or your activity tolerance. Sometimes gradual changes occur that you might not notice until they become problematic. If you're planning to significantly increase your activity level, like training for a marathon or starting a new sport, consider getting a preventative evaluation. Your healthcare provider can assess whether you're ready for increased activity and suggest modifications to reduce injury risk. Also, consider periodic checkups even if you're feeling fine. Just like you get regular dental cleanings to prevent cavities, periodic foot evaluations can help identify and address potential problems before they become painful. Let me share some specific scenarios where prevention becomes especially important. If you're a runner or athlete, you need to be particularly vigilant about prevention. The repetitive stress of these activities puts you at higher risk for recurrence. Make stretching and strengthening a non-negotiable part of your routine, and don't ignore early warning signs. If you have a job that requires prolonged standing or walking, you need strategies to manage that constant stress on your feet. This might include compression socks, regular breaks to stretch, supportive footwear, and possibly orthotics. If you're getting older, understand that the risk for heel pain increases with age. The fat pad under your heel naturally thins over time, and the tissues become less flexible, and your recovery time increases. This doesn't mean heel pain is inevitable, but it does mean prevention becomes more important. If you have other health conditions like diabetes, arthritis, or circulation problems, these can affect your foot health and increase your risk of heel pain. Work with your healthcare providers to manage these conditions optimally. Here's something I want to emphasize. Prevention is not about living in fear or severely limiting your activities. It's about being smart and proactive so you can stay active and pain-free long-term. The patients who do this best are the ones who view prevention as an investment in their future quality of life. They understand that spending 10 to 15 minutes a day on stretching and strengthening is much better than dealing with months of heel pain and treatment. Let me give you a practical prevention routine that you can start implementing today. Morning routine. Before getting out of bed, do a plantar fascia stretch with your towel. When you do get up, put on supportive slippers or shoes. Don't walk barefoot on hard floors. Do 5 minutes of gentle calf stretching. Throughout the day, wear supportive shoes. If you have orthotics, use them consistently. Take breaks from prolonged standing or sitting to move and stretch. Evening routine. Do a more comprehensive stretching session focusing on your calves, plantar fascia, and Achilles tendon. Include some strengthening exercise like calf raises or toe curls. This is also a good time to assess how your feet feel and address any tightness or discomfort. Weekly routine. Assess your shoes for wear and replace them if needed. Do a more thorough evaluation of your feet, looking for any changes or areas of concern. Consider activities that promote foot health like walking on sand or grass. The key is making these habits automatic. Just like brushing your teeth, they should become so routine that you don't have to think about them. I also want to address the psychological aspect of prevention. Some people become so focused on preventing heel pain, they become overly cautious and limit their activities unnecessarily. This isn't healthy either. The goal is confident prevention, understanding what puts you at risk and takes appropriate precautions while still living an active, fulfilling life. If you find yourself becoming anxious about every little foot sensation or avoiding activities you enjoy, that's a sign you might need to reassess your approach. Prevention should enhance your life, not restrict it. Let me share some final thoughts about long-term success. The patients who stay pain-free long-term share certain characteristics. They're consistent with their prevention routine. They don't skip stretching when they're busy or tired. They don't go back to unsupportive shoes just because they're convenient. They listen to their bodies. They pay attention to early warning signs and address them promptly. They don't try to push through pain or ignore symptoms. They stay educated. They continue to learn about foot health and stay up to date on new prevention strategies. They ask questions and seek guidance when needed. They view prevention as a lifestyle, not a temporary inconvenience. They understand that maintaining foot health is an ongoing process, just like maintaining overall health. More importantly, they don't take their pain-free status for granted. They remember how heel pain affected their life, and they're motivated to do what it takes to prevent it from returning. Here's my final takeaway. Prevention is a strategy, not a one-time fix. Small, consistent habits lead to big results over time. You don't have to do everything perfectly, but you do need to be consistent with the basics. Stretch regularly, wear supportive shoes, strengthen your feet, and pay attention to your body's signals. If you've successfully treated your heel pain, you've already done the hard part. Now it's just a matter of maintaining that success with smart prevention strategies. Don't let heel pain control your life again. Take charge of your foot health and stay active and pain-free for years to come. Thanks for watching this module. Please take a moment to like this video. If it was helpful, subscribe to the channel for more information about foot health, and share it with anyone who wants to stay pain-free long-term. Don't forget to get your free copy of my comprehensive heel pain book at www.heelpainbook.com. It contains detailed prevention protocols and exercise routines you can start using today. If your heel pain keeps coming back despite your best efforts, it's time for a long-term prevention plan tailored to your specific situation. Contact our office and schedule an evaluation and develop a personalized prevention strategy. The link is in the description below. Remember, prevention is always easier than treatment. Small habits today lead to big results tomorrow. Thanks so much for watching, and have a great day.